Good morning. I'm honored to be asked to participate in this meeting and to represent NIOSH and the work of the NIOSH Firefighter Fatality Investigation and Prevention Program. There are several NIOSH staff who are attending the symposium. I encourage you to stop by our booth, meet and talk with them, and also to attend workshops and informational sessions that they're participating in. My objectives for this presentation are to give you a brief overview of the Fatality Investigation Program, to provide some highlights since the last Redmond Symposium, to let you know of a couple things to come, and to share with you information about some other work that NIOSH does on firefighter safety and health and EMS worker safety. First, some background on NIOSH. We were established in response to the Occupational Safety and Health Act of 1970. Our mandate is to conduct research and make recommendations to prevent worker injury and illness. We are part of the Centers for Disease Control and Prevention. With the exception of the authority to approve SCBAs, we are not a regulatory agency, and we do not have powers to ensure that our recommendations are acted upon. Rather, we work in a concerted fashion with partners, including the IAFF, to encourage others to act upon the recommendations, those people who are in position to prevent worker injury and illness. The Fatality Investigation Program was established in 1998, as Pat noted, and it was largely in response to the efforts of the IAFF. We are very appreciative of the consistent input and support provided by the IAFF for this program. Based on stakeholder input, the program has focused on independent investigations of on-duty deaths of firefighters, building on a successful fatality investigation program we've had in place since the early 1980s. The goal of the program is to prevent firefighter fatalities. Through our investigations, we independently analyze what happened, identify causal factors, make recommendations for preventing future similar occurrences, and disseminate these recommendations across the country. All of our investigations are voluntary. In order to conduct an investigation, we need agreement and cooperation from fire department management and staff. We gain this cooperation more times than not based on common interest of wanting to learn from the event to help avoid similar deaths and injuries in the future. We purposefully do not seek to determine fault or place blame on fire departments or individual firefighters, focusing instead on contributing factors that are likely relevant to other departments across the country. Our investigations culminate in reports that tell the story of what happened and make recommendations for preventing future deaths and injuries. And all of our reports are publicly available on our website. The program operates out of 3 NIOSH divisions spread over 3 geographic locations. Medical investigations, such as heart attack investigations, are conducted by staff in Cincinnati, Ohio. Injury investigations are conducted by staff in Morgantown, West Virginia, which is where I'm based. When preliminary investigation findings suggest a potential role of SCBA or personal protective clothing, evaluations are conducted in labs in Pittsburgh and Morgantown. This is the investigation program team. The success and accomplishments of the program are due to their hard work and their dedication to improving firefighter safety and health. There have been a number of enhancements to the investigations over the years, influenced by input from stakeholders, including the IAFF. These enhancements include adding investigators with fire service expertise to the program, conducting more in-depth investigations, including addressing the training of incident command staff in fire dynamics, having all of the traumatic injury investigations reviewed by fire service experts in NFPA, and increased participation of program staff on NFPA committees to help ensure the investigation findings are considered in the standards. The following are examples of NFPA committees that program staff participate on. NIOSH involvement on the 1981 Committee on SCBA led to significant enhancements to test requirements in the 2013 edition, which I'll describe later in the presentation. Participation on the 1800 Committee on Electronic Safety Equipment provides a mechanism to routinely convey investigation findings associated with radio communication problems, PASS devices, and thermal imagers. Other committees that program staff participate on include the 1582 Committee on Comprehensive Occupational Medical Programs and the 1500 Occupational Safety and Health Program Committee. Based on data from the U.S. Fire Administration, since the full year of NIOSH program in 1999, there have been more than 1,700 deaths of firefighters, excluding deaths associated with the World Trade Center attack, which is a very sobering statistic. NIOSH has insufficient resources to conduct investigations of every firefighter fatality, thus we prioritize investigations. Current priorities include multiple fatality deaths and deaths in structure fires. We have completed investigations for 598 deaths, or 35% of fatalities since the program began. We finalized more than 300 injury investigations and 262 medical investigations. This figure, which is available on our website, shows the number of firefighter fatality investigations we've conducted within each state. We have conducted investigations in every state in the nation. States in the palest green are those in which we've conducted 1 to 5 investigations. States in medium green are those in which we've conducted 6 to 10 investigations. And states in deep green are those in which we have conducted 11 or more investigations. If you go to our website and click on a specific state, the website will generate a list of all the investigations conducted within that state. This is a map from an under-development web application that I'll discuss later in the presentation. I'm showing this slide here as it depicts our in-process investigations. The team is currently working on 22 fatality investigations, including 4 complex events that involve multiple fatalities. The multiple fatality events are those with the purple marker, and they include the 3 recent tragedies in Texas, including the recent Houston event, which will be discussed later today. We're also wrapping up the investigation of a double fatality in Philadelphia that will also be discussed later. This is an extremely heavy investigation workload, which is negatively impacting our ability to release reports in a timely fashion. We've recently declined doing some investigations in an effort to catch up on this backlog, and we're doing this on a case-by-case basis. This is a screenshot of the program webpage, and the address is at the bottom of the slide. The website includes links to every fatality report, a list of pending reports, and publications, including publications which summarize findings across investigations and focus on specific topics. This website is among the most visited on NIOSH's webpage, with approximately 140,000 visits in 2012. I'd now like to turn to highlights since the last Redmond Symposium in 2011. One of the more recent program enhancements is increased use of SCBA data loggers in investigations. Newer SCBA with integrated PASS devices collect and store alarm data, and some SCBA also collect pneumatic pressure data, such as when the cylinder is turned on and off, breathing rates, and cylinder pressures. In most cases, only certified repair technicians have download capabilities. We have worked in several investigations with the cylinder manufacturers with the approval of the fire department to download and interpret data in these loggers. The data, in conjunction with other information, such as witness statements, radio traffic, video, and other media, help develop a likely timeline of events. This is an example. In this Kansas case, the firefighter died from asphyxiation after vomiting in his face piece. The data helped identify the sequence of events, including the firefighter turning off his cylinder for approximately 2 minutes while he took off his face piece to try and clear the vomit. This is indicated on the graph by the precipitous drop in the upper and lower graph lines. Based on other information, we know that the firefighter was exposed to heavy smoke during this time. The logger also identified when the cylinder was turned back on, indicated by the graph lines going up, when the firefighter became unconscious, when alarm sounded, and when he was removed from the structure. This data helped us to understand the events and recommend that groups such as the IFF and NFPA develop procedures for clearing vomit in the face piece without removing it, such as by using the bypass. This was one of 2 cases that we've investigated in which trying to clear vomit contributed to the fatality. Another highlight since the last Redmond Symposium is the development of NFPA test methods that will result in SCBA with face pieces that are more resistant to the extreme fire environments that firefighters sometimes encounter. We're proud of the investigation's program's role in contributing to this. Investigators identified a number of cases in which it appeared that face pieces had thermally degraded while the firefighter was still on air, exposing them to extreme heat and smoke. The program brought these findings to the NFPA SCBA committee. NIST subsequently confirmed in laboratory studies that the face pieces could quickly degrade in extreme fire environments. The NFPA committee subsequently developed enhanced test requirements. We expect SCBA that meet these new requirements and are more resistive to extreme fire environments to be available in the next several months. I'd now like to give you a heads up of some things you can anticipate from the program in the future. Earlier, I showed you a developmental map identifying in-process investigations. We are wrapping up work on an interactive tool for our website that will allow users to map firefighter fatalities and generate statistics based on U.S. Fire Administration data. Users will be able to obtain basic information on each death, information on whether NIOSH has or is investigating the death, and links to finalized NIOSH reports. We're currently revising the mapping program based on stakeholder input and anticipate it being available on our website in early 2014. We are committed to routinely seeking stakeholder input and plan on seeking input again in 2014. We will open a public docket and hold a virtual meeting to describe the program and accomplishments and propose future directions. Announcements will be made in the Federal Register, on our website, and through other NIOSH media such as e-news and Twitter. As noted earlier, IFFF has consistently provided support and constructive suggestions for improving the program, and we look forward to IAFF yet again providing input as well as members and other groups. And the input will be used to guide the program in the next few years. I'd like to take a couple of minutes to share with you information about other NIOSH work with relevance to firefighter safety and health of EMS workers. So NIOSH does a considerable amount of firefighter safety and health research. To help stakeholders find information about this work, we've recently added a firefighter resources directory to our website. The address is at the bottom of the slide. This directory includes links to other research and programs, including the Cancer Study, the Investigation Program, the World Trade Center Health Program, SCBA, and wildland firefighting resources. We have another website focused on EMS workers. This website includes links to data on EMS worker injuries and to information on ongoing research, including a project that's working in partnership to improve the crashworthiness and safety of ambulances, and another project developing disinfection practices and equipment to protect EMS workers from infectious diseases. Finally, I'd like to call your attention to workshops and information sessions that NIOSH staff are leading or participating in the symposium. Later today, NIOSH staff will be leading workshops on respiratory protection programs. The workshops will be technical and focus on NIOSH observations of field SCBA maintenance and training. The focus will be on the CBRN respirator and its unique characteristics, although some information will be applicable to all respirators. Tomorrow morning, there will be workshops on the NIOSH Firefighter Cancer Study. These workshops will provide information on this landmark study being conducted with funding support from the U.S. Fire Administration and discuss the risk for various cancers and illnesses among firefighters compared to the general public. And NIOSH staff will also be participating in the Ask the Doc session later today and the Occupational Diseases and Infectious Disease workshops tomorrow. I encourage you to attend these sessions and to meet and interact with our staff. I'd like to wrap up by expressing on behalf of myself and my NIOSH colleagues sincere appreciation for the opportunity to work with you to improve firefighter safety and health. We're very appreciative of our partnership with the IAFF, and we look forward to continuing to work together. We strive to make our products and recommendations useful in your work, and we welcome suggestions and input for improving our services and the impact of what we do. The website for our program is on the slide. I encourage you to check it out and see what we have to offer. I've also included my email address if you have questions or if you'd like copies of my slides. Thank you for your attention, and thank you for all that you do day in and day out to keep people safe and keep our resources safe.